Hi, thanks so much. Thanks for having me here today. My name is Elizabeth Buzney, and I work in Boston, Massachusetts, at the Brigham and Women's Hospital as part of MGB Dermatology. So the most important one from a dermatologic standpoint is routine skin exams with attention to pigmentation changes. We do see that many, not all, but many patients' skin tans while on afamelanotide, as we would expect it to, and we see that their moles get darker as well. We have not seen an increased risk of melanoma in these patients, but their moles are changing, they are darkening. And so it makes it more difficult to identify, or in theory, it could make it more difficult to identify if there had been a mole that was changing in such a way that would imply melanoma. So not that the drug itself is causing melanoma, but rather that the moles are changing and we have to continue to monitor them as a result. What else? Liver function test monitoring. Periodically. And that's given the underlying EPP hepatic risk. Again, it's not drug specific. I typically do protoporphyrin testing along with liver function testing once yearly, or more frequently if there seems to be a need for it, that there's some concerning changes. Let's see what else. We can assess the implant site for local reactions. Again, that happens very infrequently. And then when we see patients back, what we're asking them is, how has your light tolerance improved? What is your quality of life looking like? Is it changing? Is this working for you? We do see that this is often seasonal, depending on where patients live. So for example, in Boston, I have many patients that stop their treatment over the winter because they don't find that they go out enough in the winter for it to matter for them to continue. Alternatively, I have some patients who are so incredibly light sensitive, including to visible light, that they must have treatment all year long. Or they could be very active outdoors in the winter with snow, snow sports, for example. So everyone's a little bit different, but you should be sensitive as the treating physician to what the seasonal symptom patterns are of your patient that would make sense in terms of their treatment and how you approach it. And of course, it's a very odd thing, but you start having to reinforce sun protective behavior in conjunction with treatment. This is for patients who have never gone out in the sun before, and all of a sudden you're giving them a medication that allows them to go out in the sun, and you have to counsel them about sun protection, which sounds so counterintuitive, but they may not have had to ever do that before, or they may be so excited to be able to go out in the sun that they overdo it. And so this is also very important as well. So these are all things that we talk about when they come in for their implants, but then also when we do their skin exams, which we do every 6 months for patients on afamelanotide.